Hello, my name is Caddy Cowan. I'm a DNP student at East Carolina University. Today I'm going to talk a little bit about Health Information Exchange. I'm going to talk about what it is, how it works, what legislation regulates it, and talk about some recommendations to advance implementation of it. Health Information Exchange, also abbreviated as HIE, is a system that allows the sharing of medical information by healthcare professionals of all different disciplines, including physicians, nurse practitioners, pharmacists, physical therapists, and many others. The goal of HIE is to improve patient outcomes, to reduce hospital readmissions, and to reduce healthcare-related costs from duplicate testing like duplicate laboratory or imaging studies that are not necessary. HIE also has the potential to positively impact safety and quality of care and to reduce the numbers of medication and medical errors that occur. There are three different forms of HIE, and these are known as directed exchange, query-based exchange, and consumer-mediated exchange. A directed exchange is when a provider can directly send information to another provider. This information can include hospital notes, office notes, laboratory studies, discharge summaries, and many others. And this is helpful when someone is being referred to a specialist. The provider can directly send the information to the other provider. The second form of HIE is query-based exchange. And with this system, the provider goes in and directly searches for information for the patient that they're seeing. This is helpful for an emergency department provider or someone that works at an urgent care, or if the provider is just seeing the patient for the first time. It also can help decrease healthcare costs because they can see whether a patient has had a particular study done, imaging or laboratory, and they cannot order testing if it's not necessary. The final type of HIE is the consumer-mediated exchange, and with this type, the consumer or the patient decides what providers they want their information sent to. And this increases patient autonomy and makes the patient a central part of their coordination of care. Federal legislation related to HIE includes the Health Information Technology for Economic and Clinical Health Act, also known as the HITECH Act. This act was included in the American Recovery and Reinvestment Act of 2009, and the act was made to promote the use of electronic health information as a tool to reform the delivery of health care and to improve patient outcomes. When it was originally enacted, the HITECH Act promoted the use of health information technology by providers that were serving Medicare and Medicaid beneficiaries. Providers and hospitals could receive incentive payments through the Centers of Medicare and Medicaid if they were eligible based upon their meaningful use of electronic health record systems. The Act was also implemented to improve the exchange of health information by encouraging providers to participate in electronic sharing of health information. Under the Act, states were allocated funds to encourage health information sharing, and the U.S. Department of Health and Human Services continues to work under the HITECH Act to develop strategies to promote the use of health information sharing. The HITECH Act is not the same as the Health Insurance Portability and Accountability Act, also known as HIPAA. They're separate laws, but the HITECH Act strengthens and reinforces the privacy of HIPAA. Notable progress has been made under the HITECH Act. In the year 2015, 90% of hospitals and 78% of physicians were using some type of electronic health record system. This data was according to the Office of the National Coordinator for Health Information Technology. They also noted in 2014 that 4 in 10 physicians were electronically sharing information with other providers, and more than half of physicians were electronically sharing information with their patients. Barriers identified within a HITECH include some diversity of EHR systems, uneven electronic health record intake by certain providers, and the willingness of providers to share information with other providers that are outside of their health system. The widespread use of EHRs makes it possible to increase HIE, and in 2015, the U.S. Department of Health and Human Services implemented a wide range of strategies to promote the use of HIE, and they continue to use these strategies today to advance implementation. In 2015, the General Assembly of North Carolina established a state-managed HIE authority to regulate and oversee the North Carolina Health Information Exchange Network. The Health Information Exchange System is called NC Health Connects, and it's a secure, standardized electronic system where healthcare providers can share patient information. The North Carolina Health Information Exchange Act contains specific regulations and requirements for providers that serve Medicare and Medicaid beneficiaries. The Act requires that all providers that receive reimbursements from Medicare and Medicaid be enrolled in NC Health Connects by June 1st of 2019. This is an extended deadline, as the original deadline to join was February 1st of 2018. The Act also provides funding to assist with upgrading health information exchange systems. Barriers to NC Health Connects include provider concerns of sharing protected health information and the cost of purchasing or upgrading electronic health record systems. I've identified 2 recommendations to advance implementation of HIE. The first recommendation has to do with the lack of knowledge providers may have related to HIE in general and the concerns of keeping patient information secure. I recommend that representatives from NC Health Connects have workshops or online webinars to provide information for providers and other staff on HIE and to answer any specific questions that they have. It may also be helpful for representatives from NC Health Connects to travel to clinics and work one-on-one with providers if needed. Providers with a better understanding of the system will be more supportive and engaged when using HIE. The second recommendation is to allow providers to select what type of HIE format that they use. The provider may choose between directed exchange or query-based exchange. Learning one type of HIE first may make the provider feel more confident in the system, and then they may be more willing to use the entire system and all the features of it. HIE has a great potential to increase patient outcomes while lowering health-related costs due to duplicate testing. Thank you so much for listening today.